Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. What do you know about joints? Well, today that's our topic. We're going to be talking about the anatomy of joints and why that's important. Why should you care? The adult human body is made of 206 bones, which perform like basically structural scaffolding. It helps support the body to move, and except for one neck bone, the hyoid bone, the rest of the bones connect to at least one additional bone. The junction or joint is where two bones lie adjacent to each other and where they can move or not move, and that's called a joint. Most joints allow for and facilitate movement and between the bones and joints in your body. And ironically, the community of professionals often disagree on the exact number of joints in the human body based on a debatable definition. But for the sake of what we're talking about here, adults have around 350 joints. So the joint has different components. It has cartilage, which refers to the tissue that covers the bone surface where the bone meets the joint and helps reduce friction in the joint. Also, the meniscus is cartilage in knees and other joints that are curved. Next are ligaments. These are strong, elastic, connective bands of tissue that connect bones and offer support and limit a joint's movement. Tendons attach muscles to bones. They're located on each side of the joint and are responsible for the movement of the joint. And then you have the bursa, which is like a little fluid-filled sac between the bones, ligaments, that cushion the friction of the joint. The human body's joints are classified based on the joint's range of motion and tissue that holds the nearby bones together. So typically healthcare and medical professionals classify joints into primary categories, three of them actually. Fibrous joints, they're very inflexible. These are like the plates in your skull. Cartilaginous joints, they have some limited movement, like the breastbone, for example, so very, very small amounts of movement. Then there's synovial joints, they have the most movement, and they're where one bone fits snugly into the cavity of another one. And these types of joints typically have a membrane. It seals the joint capsule and provides fluid to lubricate the joint to add cushioning against the friction created by movement. Also, they're hinge joints. This is something that opens and closes in only one direction, like your elbows or your knees. Next, you have a ball and socket joint. It's a type of synovial joint. One bone with a rounded end fits into the indentation of another nearby bone, hence the ball and socket. It's quite versatile. So you can basically turn in any direction. Some examples are your hips, your shoulders. Next are condyloid joints. They're like the ball and socket joints with some rotation limitations. They're two oval-shaped bones that fit together, like your wrist, for example, your toes. Next are saddle joints. They allow for movement in any direction, but can't rotate or twist. They're formed when two curved bones meet, like your thumb meeting your hand. Next are pivot joints. They allow for rotation without adjusting from their original position, like a pivot joint in your neck lets you move from one side to the other. And planar joints are formed when two mostly flat bones meet and move when one bone slides over the other, like the spinal vertebrae and the carpal bones in the wrists. So as chiropractors, we treat different joints, joint conditions like inflammation or swelling, redness, discoloration, warmth or heat, grinding or popping noise. We treat these types of issues. And when you use your joints, whenever you do anything actually, from walking around to sitting here listening to this, most likely, these are pretty important parts of your body. They have to be nurtured, they have to be taken care of, they have to be protected from wearing out. So if joint pain disrupts your life and the joint gets stiffer and stiffer, you've got a real problem. So when that happens, make sure you contact a chiropractor as soon as possible. And in our office, New Hope Chiropractic, we help with those exact types of conditions. Also, we'll help your joints from wearing out prematurely, so you get more life out of your joints without having them replaced. And that's typically never as good as the original joint. So check us out at newhopechiropractic.com to book an appointment today, and we'll be happy to help you. Have a healthy day.